Severe bleeding can be life-threatening and can look very frightening. If the bleeding isn't controlled quickly, it is possible for someone to become unresponsive and possibly develop shock. The most important thing is to stop the bleeding. Wear gloves, if possible, to protect yourself and try to keep the wound as clean as possible. Apply pressure to the wound with a clean cloth or sterile dressing to stop the bleeding. If neither of these is available, use whatever you have. If you don't have a dressing, ask the injured person to press on it themselves. Cut or move clothes out of the way so you can see the wound. If something is stuck in the wound, don't pull it out. It might be helping to stop the bleeding. You should try pressure on a limb wound first before applying a tourniquet, but you have to be ready to use it. Firmly secure the dressing with a bandage to maintain pressure on the wound, making it firm enough to maintain pressure but not so tight that it restricts their circulation. If blood soaks through the first pad or dressing, remove the first dressing and apply a new one with direct pressure. Keep this pressure applied the whole time. Ask someone to call 999 or 112 and tell ambulance control where the wound is and how bad the bleeding is. If you're alone, use your phone speaker so you can talk to them while giving first aid. A tourniquet should be used on a catastrophic injury and must only be used on a limb. You should consider their use carefully, as it is likely to be painful for the casualty. If you do not have a tourniquet, you can use items such as a triangular bandage, a scarf or tie, and use a pen, a fork or a tourniquet, if you have one, for the rod. A belt pulled tight can also work. To apply a tourniquet, ensure the casualty knows you are applying it and that it will hurt when you tighten it. Wrap the material around the limb, cross over the ends. Tie in the rod or tourniquet with a knot. Twist the rod to stop the bleeding. Secure the rod or hold it in place. As with the hemostatic dressings, if you are in any doubt, you should ask the advice of the call handler. Once a tourniquet is applied, it should not be loosened, as the bleeding may start again. Losing too much blood can cause shock. To treat it, help the person lie down on a blanket or rug. Raise their legs above their heart to help blood flow. Keep checking their response until help arrives. If they become unresponsive, get ready to start CPR. Treating an open wound quickly and correctly can help save a life. You should wear gloves for safety, apply firm pressure, call emergency services, apply a tourniquet to limb injuries, secure dressings, monitor circulation, watch for signs of shock. Remember to stay calm and continue to provide support until help arrives.